What do you think about when you hear the word hospice? For many, if not for most of us, we think of death. We think of the grim reaper or the angel of death coming to get us or our loved ones, or walking towards that bright light at the end of life's journey. But hospice isn't about death, it's about living. It's about life. Hospice is a type of care that focuses on living, about living life as fully as possible, up until the end of your life. Let's start by taking a look at some hospice facts. Based on current trends, the National Hospice and Palliative Care Organizations project that more than 1 million U.S. patients will receive hospice care this year. The use of hospice continues to grow. But for every person who receives hospice care, another third are not receiving the care in an ample amount of time. They're receiving less than 7 days of care, which is not enough time to get the services that are fully available to them. And that's why it's an objective of the Cancer Plan to increase the appropriate utilization of hospice services. We plan to increase the use of hospice by conducting large-scale awareness and education campaigns and by educating healthcare professionals about hospice. I just told you a little bit about where we've been and where we want to be, but we need to learn more about what it is that has happened in the past in order to get to those goals that we have set. And so that's where I'm going to talk a little bit about the history of our caring for our dying and about hospice. The term hospice, from the same linguistic root as hospitality, can be traced back to medieval times when it referred to a place of shelter and rest for weary or ill travelers on a long journey. The word hospice comes from the Latin word to host a guest. In the tribal and pre-Christian eras, when there was a life-threatening illness, the community responded because death posed a threat to the entire community. Because individuals worked for the common good of the community, they would support that individual. In Europe, with the spread of Christianity, monasteries started to take the sick and dying. Then, in the 6th and 7th century, wealthy women and widows started working in the monasteries as the first nurses, providing what we now call hospice care. The name hospice was first applied when caring for dying patients in 1842 by Jean Gagné of France. The name was next introduced by the Irish Sisters of Charity when they opened Our Lady's Hospice in Dublin in 1879. In the 1940s, Cicely Saunders was inspired by a terminal patient as the two discussed how she might open a place that would better care for those who are dying and also help them control their pain, something better than a hospital ward. Saunders opened St. Christopher's, and we've come a long way since. While lecturing at Yale University, Saunders introduced the concept of hospice to the United States and to Florence Wald, the Dean of Nursing, which eventually leads to Wald and her 3 colleagues starting the Connecticut Hospice. By the 1980s, we saw the Medicare hospice benefit introduced. And as the 21st century has gotten underway, we see the number of individuals receiving hospice care, along with those providing hospice care, continue to grow. So why hospice? Often families are upset when they hear the recommendation for hospice because to them it means that they're giving up on a loved one. But what it can really mean is a shift of perspective from curing a loved one's illness to providing comfort and support in their end of life. Hospice respects an individual's wishes and offers us a chance to die with dignity. Hospice provides a team that will collaborate with your healthcare professionals to coordinate treatment and care and build in a support system for the needs of the individual and the family. Individuals with serious illnesses often undergo invasive treatments and spend significant time in the hospital, but hospice can manage an individual's pain and symptoms and enable them to remain someplace where they feel comfortable and familiar, such as their home or a facility that provides hospice care. The hospice team addresses physical, mental, emotional, and spiritual needs, and the clinical staff, such as doctors, nurses, and therapists, along with social and spiritual care providers, can address the comprehensive needs of the individual and their families. Medications related to the terminal illness and to manage pain are covered along with medical equipment. As needs change, medical equipment may be brought in to maintain independence and mobility and to improve the quality of life for those individuals. Hospice provides different levels of care to help manage symptoms. Everyone's disease process is different, and everyone is treated as an individual. And care is provided through those various levels of needs, including respite and bereavement care for the families. With hospice, families can focus on spending time with their loved one. When physical, emotional, and spiritual needs are addressed, the precious time remaining can be spent concentrating on those things that matter most. such as living, and that is why hospice.